All right, so we are here with Wendy Edwards. She runs a business of Aniron. She is a functional medicine and integrative psychiatrist. So, Wendy, to someone who has never heard of that before, can you tell me what that means?
So what it means is I treat the whole person. Is treating the person symptoms at their root, and also means treating the person comprehensively. You're looking at the whole person physically and also mentally, I guess, in a way. So that's basically what the whole mouthful means.
Yes. So, what kind of people do you see from, kids to women to men? What's something that you often treat?
So I treat adults, I treat children, women, men. So I'm open to anybody that is looking for that approach where they're trying to figure out where things are coming from, but they have not find the answers to, or they have issues that um, they're complex because the providers that they have seen have not been able to help them. The same way I try to incorporate a lot of things into my practice, things that I know it might help my patients. Um, so anybody that fits and meets that criteria, they're welcome to come and see me.
Yes. So, can you give me an example of a patient of yours and just kind of walk me through what it looks like to get treatment from you?
Okay, so normally everybody starts, they come to me through an initial consultation. I'm very thorough. Part of doing functional medicine, which is the foundation of everything I do, even in psychiatry, is figuring out where things are coming from. What is this patient saying? What are the symptoms? How did it start? It? What else might be related to it? And part of figuring it out is finding out everything about the person during that first visit. Um, I develop a treatment plan, and normally this is like the foundation of everything we're going to build from there. I use medications as needed. I use supplements. I'm very huge for it. Nutrition. I provide my patients with meal plans, recipes. If they want to go gluten free or anti inflammatory, they can try many things. I just incorporate them into that foundational treatment plan. And from there, we go into labs. And labs are very important in this field because trying to help a person is always like putting a puzzle together.
Right.
When you go to a conventional setting, you normally do the basic labs and you also go by the normal ranges. But functional is not about that. Functional believes that the more you're able to kind of decipher from this person, whether you're looking at the labs or hearing to the symptoms, the more clues you have as to what is it that they have going on.
Mm-hmm.
So, blood work is part of what I do. I do very comprehensive blood work, even for children. If they have mental health issues, I'm testing vitamins. I'm testing their thyroid
Yeah.
because I know that's going to affect. And the same for men, for women. After doing blood work, I'm also incorporating other type of testing, not necessarily just blood work. I do genetic testing is huge, especially when it comes to psychiatry. I incorporate things like hair minerals when it's needed, especially for kids. Blood spot is a good alternative for them since phlebotomy is really hard to get for them. So I incorporate different types of tests. O test, which is the organic acid test, different things that can clue me in what is happening with this person that the blood work might not reveal.
Yeah.
And from there, the treatment plan develops basically in how the patients respond. If a patient is responding well to something or we need to change things, um, but all the treatment plans, even if you have patients that come just for the functional medicine part and they don't want, there is no psychiatry per se involved, I'm always mindful, is this person stressed out, is this patient feeling bad about something? And I try to incorporate that in the treatment plan, whether I'm treating psychiatry alone or psychiatry functional, or either I do just the functional side when I'm trying to kind of help the metabolic issues in some bodies. But yeah.
So a lot of the times you'll hear people say like, I got labs done and they came back normal. So what do you think about that?
I roll my eyes all the time.
I saw that look you gave.
I'm like, I roll my eyes, they face that way, and I'm like, normal doesn't mean anything to me.
Okay.
If you, for example, today, I had a patient that all her labs had come normal, but for 10 years, she has been feeling sick.
Yeah.
And we did this all questionnaire. This is what I tell them in your initial consultation. I'm interrogating you because I need to hear. And all her labs are normal, but guess what? She has all these issues, and I'm like, thyroid. Oh, hormones, hormones, thyroid. How is that? You miss the whole mark where you go just by a report, because the report is based on ranges done in a population, but it doesn't take into account the singularity, the individuality of a person, where you're like, oh, wait, so this male that is 27, is it comparable to have a testosterone of 200 if you're in your 80s? No. So that's where functional is also different. It's always looking to optimal levels. And even when you have optimal levels, you listen. Because patients have the information already. And most of the time, if you go by the labs, you completely miss the diagnosis. And that's what happened to this lady.
Yeah.
Because she never showed up at normal. Oh, and now I'm feeling like this. And I'm like, all your symptoms are saying thyroid. And now here you have the hormones acting out already because this was not addressed, and you're getting into perimenopause. So anyway.
So do you have a favorite patient that you're like, oh, I love to treat this type of thing, or it just feels very fulfilling to see this type of person come in and know that you can help them?
The ones that haven't found answers, which is about pretty much everybody.
Yeah.
The reason is because it's very, I don't know, it's not about satisfaction or feeling like you're doing something good, but it's actually about providing relief. Those are the cases that bring me close to who I was as a patient myself when I was having issues, and I went from a specialty to a specialty, different providers, and nobody could help me. Nobody could tell me what was going on with me. Nobody could relate to me. And here with my patients, I'm like, I was that patient. I wasn't listened to. And yes, everything was normal in my labs, but here I still have issues. Can you hear what I'm saying? I'm having problems. Can you help me? So those are the patients that actually kind of hit home for me. Like the patient that was here early. Okay, you want to go this approach. I respect your lifestyle. I respect that this is how you want to do. And I'm not going to ask you to change. But what I'm going to do is that this plan adapts to you and not the other way around.
Yeah.
So I think those are the patients that are more, I'm not saying I have favorite patients. I think they're all great. I love my patients. They're very understandable and they put up with me. But anyway.
So do you see a fair amount of women postpartum who are dealing with issues? I feel like that's like a common, you hear about like postpartum depression and anxiety. Do you feel like there's more to it than maybe just getting on like a medication, or what do you think about that?
So the majority of my patients are females. I have a few that are postpartum. I just met one yesterday, and there are alternatives that sadly conventional is ruling out and not considering because it's very evidence-based, which is why we still use them functional, but they are really dismissing that because they were in 100 studies on this, oh, we shouldn't use it for everybody. But they have shown to be beneficial in some studies. that is proof that maybe we can try them in patients.
Yeah.
And I do have those patients when it comes to postpartum, because the thing about postpartum is this: you have this massive change happening to your body, huge requirements, huge demand. Your body already has a demand of metabolism, energy, and everything, every single day, every single hour and minute that you're alive.
Mm-hmm.
And here you are dumping all of this. Well, let's create life, another human being inside of you. And that creates a super demand. And here you have all of this. I mean, we can even think, isn't that odd? Or it's not, that women tend to develop, those ones that are susceptible to Hashimoto's, they normally get the diagnosis after pregnancy at some point,
Yeah.
because imagine all that demand, which equals stress. And when we have these postpartum patients, whether physically they feel fatigue, physically they feel, tired, but emotionally they're also overwhelmed, you always have to think, what can I give this patient that, oh, she wants to breastfeed her baby,
Mm-hmm.
that might be safe, that we can use, that it can be helpful, and she can safely do it. And they are alternatives.
Yeah.
Yes, research says that we need to do SSRIs, but guess what? There are other things that can actually help a woman, because it's treating the root cause. If you think about it, deficiencies are huge for this population, because
Yeah.
they went through this amount requirement the baby needed, and the baby's taking all these nutrients. They have a massive change in the blood volume. Here, replenishing those things can be very helpful for them. And there are other things that you can implement and really make things different for them, where they can again be have a quality of life, enjoy having their baby, and not feel bad that, oh, I'm taking this, but I don't know if my baby's gonna get hurt, or
Right.
oops, I cannot take this. Some women even stop their meds because I don't want to take it, and then you see them suffering emotionally and physically too.
Yeah.
Mm.
So I've thought of a patient as you were speaking. I was seeing her for stress incontinence. She wanted to return to running. That was part of her mental like outlet, right? Was being able to exercise and run, but she couldn't do it without leaking. So that's what I was seeing her for. But she later told me that she had been taking antidepressants since her baby. It was like 2 years ago. But she was like, and I want to get off of them, but I have no guidance on like is it safe to just be done? Do I need to taper it out? Or so I feel like she kind of, there was a gap in care, right? Like, what would you say to patients who maybe are taking it or are worried about taking medications of, it's safe or it's helpful, and there's, it's not a like a terminal diagnosis is not the right word or anything, but it's not like a forever solution.
Um, so for my patients, I give them the option that, and I always explain to them, here are my tools. I'm putting them on the table. You are in control. I'm here, your cheerleader.
Yeah.
I'm here next to you. I'm not in front of you telling you what to do.
Mm.
You have that empowerment, and I want you to use it. Now, I'm always mindful to set all the tools, because I tell my patients, these are my goals of any treatment. Number one, I want you to feel well. And for that to happen, whatever you might need, we need to utilize. The other thing is quality of life. What quality of life do you have right now that I can improve if I manage things? And safety, that's a given.
Yeah.
So when you think about it, what you're doing for somebody in that term, then you're thinking, what kind of tools I need. If you're having an infection, and I see that is red, swollen, warm, and well, I can put you in an earth, but I'm in my mind is like, how much does it hurt you? Are you able to walk with that? Are you able to go out and do your things with that? No? Then okay. A nerve might be effective, but it takes some time. Okay, maybe I need to stabilize you. That's the other goal. We want to stabilize something that it has bothered a patient, that it has really intruded in their quality of life and improve it. So is a medication called for? Maybe. Is there an alternative to something else that if the patient doesn't feel comfortable to medication supplements? Maybe. But for me, is laying all those tools for them and realize these are all the options. And I ask them, what direction you want to take here?
Yeah.
Because this is your treatment plan. This is not my treatment plan. It's yours. And that's where I see people that are open to anything. I have very few patients that are completely natural, and I support that because it's not my way. It's not my right to tell them what to do.
Yeah.
It's my right to support them and their journey anyway.
Yeah. Inform them, give them the options, let them be in charge.
Yeah.
I like that. So before, you've talked to me about some rants, right? Sometimes you get on rants of just things you're really passionate about. I would love to just end with something that you just want every woman to know, every person to know, just about like their health, just something you feel like is maybe lacking in conventional medicine that you want more people to be aware of.
One thing that I'm passionate about telling my patients is that when they come to me, they learn to become intuitive. This is about me sharing and developing a treatment plan with them and saying, what do you think? Are you having this issue? Well, let me think about it. Well, no, maybe I do have a symptom. I just thought that it was normal. I empower patients. I empower patients so that way they are in control of the treatment plan. I empower the patients so that way they listen to their body. Is this the right thing for me? I said, no, what is my body saying? Because we often, when we do things under conventional, here is your treatment plan. Call us if it didn't work, gets worse. Okay, bye. I'm not that type. My patients know that I give them these treatment plans, that I'm providing the tools, but they also decide what they want to do and what they don't want to do. They don't feel comfortable. I just like them for that. And to listen to themselves, because for so long we have been told that everything is normal when reality is not.
When you can feel inside, you know something's wrong.
This was this patient this morning. She's like, I knew something was wrong. And I'm like, don't let anybody convince you otherwise. You're not losing your mind. You're not making it up. You're not inventing things. You have something. Listen to it. Your body's actually making you feel aware of something. But unfortunately, labs alone, or just basic labs, will not tell you the whole story. That's why the initial consultation is a lot of questions, because the more I hear this person, is like they're witnessing, I'm witnessing what they're telling me is happening to them. And finally they feel like, yeah, okay, so I wasn't crazy, I'm not making it up. And I tell them, no, it's not in your head. You actually have something. So I empower my patients. That's the crucial thing. Patients need to feel like they are in control and they can do things. They can actually work on things and don't feel like they have an impossible mission plan.
Right. Change can happen. Improvement can happen.
Yes.
I love that.
All right.
Well, Wendy, where can people find you if they're interested in working with you?
So I'm in Linden. I'm also in Bountiful. Anybody can go to my website, Aniron, fmip.com, and send me a question, or if they want to know about what I do. But I'm in Linden. I'm also licensed in other states. I'm licensed in Idaho, Arizona, Nevada as well. So I can do telehealth there, and even in Utah.
Okay, great.